Greetings and welcome back to another episode of Well, Why Not? Today we are going to talk about my thoughts on the medical system here in Ecuador. It's a big part of deciding where to make your new home. Even for the most healthy individual, you have to think about unexpected injuries or even unexpected illnesses. So I'm going to tell you all about my experience. Let's get started. The idea for this episode came to me because the algorithm on YouTube, for some reason, kept showing me videos of Americans who, while abroad, realized how, quote unquote, America had messed them up. And of course, it's all in jest. They're very funny videos. They're compilations actually, and I think they're from TikTok, but have been shared on other social media platforms, and I just happened to come across them on YouTube. So on all the compilations that I saw, each and every one of them had a reference or more to things that surprised people about foreign medical systems, especially in comparison to the American one, whether it was the cost of medication, the cost of seeing a doctor, or how easy it is to get medicine at a pharmacy without a prescription. This was just over and over again, along with, violence and racism. But this topic, I think, is, again, so important when making your decision. Okay, so I look at it as, again, even if you are a healthy young individual, if you are a family with children, if you are a retiree, I don't care who you are. As humans, we are destined to get sick at one point. We are destined to need medical help or medical assistance at some point. So it's important to make sure that your new home has the facilities, has the ease of access, and the affordability for medical services. So I want to start by talking about more my own experience, and as with everything, it's important to qualify my own experience versus other people's experience, because I've heard horror stories, but I've heard horror stories from everywhere. I don't think there's any perfect place, nor is there any perfect system, but there are aspects of the Ecuadorian medical system that I prefer, that work better for me, they work better for my family and my expectations. So starting with just preventive care, I find that it is different preventive care here. I have used the private system, which means we pay out of pocket. There is a public system that Ecuadorians pretty much subscribe to once they're working, and it works, I would say it works similarly to insurance in the US, because you basically have to go through your primary care physician to get a referral to specialists who will then determine if you need additional tests or additional treatment. This isn't something that you can sort of preemptively do, and I'll explain more about the private system. But it works. It's slower. These are things that I hear people say about the Canadian healthcare system, because they have universal healthcare, and as well as the UK, that you wait, that it's not as quick, that you are sort of at the not the beck and call, but you have to wait for your doctors to make decisions, to complete the proper paperwork for you to get the care that you need. And that can be frustrating, absolutely, especially when you are sick. It's compounded, waiting for things seems like an eternity when you're not well. So in terms of the private system here, I don't have to wait for anything, and I don't need a primary care physician to refer me to a specialist. I can just make an appointment with a specialist. In terms of costs, upfront for preventative care, to see a primary care physician, so it could be like internal medicine, sorry, or a generalist. I have not seen DOs, doctors of osteopathy. I'm sure, or actually I shouldn't say I'm sure, I just haven't seen them. I have seen pediatricians for the kids, and I've seen I think they're called internists. Someone let me know. Anyway, so with those sort of general medical professionals, the average visit is $20 to $30, just depending on the facility you go to. So some have their private practices, and in those cases, I find they tend to be on the cheaper side, so the $20. But if you are going to a clinic, and the way that some of these private clinics work is the physician or the specialist kind of rents the space. So as patients make appointments for whatever specialty or general medicine, then that person gets to use the facility, and the facility has receptionists, and it has a lab, it has just the basics that you would need. It has, you could get your x-rays done there. So it's convenient for the patient, and then the medical professional has to show up at that time of the appointment to see that patient. And in those settings, I think obviously the $30 or the additional expense is because the facility gets to keep a portion of it and the rest goes to the medical professional. But again, it's a question of, do you want to pay a little bit more for the convenience? Because if you go directly to a private practice, that may just be the consult. They're not going to be able to take your labs and do all the follow-up. And one thing I have to point out that is very different with the medical system here, but I find that most medical systems outside of the U.S. function that way, or at least the medical systems in Latin America, is that you, the patient, you receive your results, your lab tests. That it's not something that gets kept in a system, and then, that's been my experience. And I've never asked when I was in the U.S. for my results directly. I don't know. It was almost like it wasn't a thing, right? You go, you get your labs, and then you wait for those lab results to get sent to your physician. And then when they're ready, somebody from the office will call you and either say you need to come do a follow-up appointment or you need to get additional tests, whatever it may be. However, here you go, you get your labs, they are sent to you, and it's mostly electronically. They'll even send them to you via WhatsApp, or they have systems that you log into with a username and a password, and you get your results, you see them. I mean, I think in terms of general lab tests that we get every year and we've seen so many times, you do become familiar with the terms and you can kind of read your own results. Obviously you can't diagnose yourself, so you still need to go see your physician. I don't know, I've always felt like maybe that's why they didn't do it in the US, like with this fear that if you see your results, you diagnose yourself. But there are so many other barriers to that I don't know. So yes, you get your results, and then it's sort of on you to take those results or send them to your physician. And again, most physicians now will have you send it to them electronically, and then and similar follow-up, they'll say, okay, come to the office and we'll go over them, or I'd like you to also take these tests. And it's just done quicker. I find the wait time because you're getting them directly. Honestly, if you go take some like your basic labs, like your cholesterol, glucose, the ones that you usually get for like an annual physical, in the morning, by midday you have your results. It's pretty quick. So then, from that time, sending it to your physician that same day, depending on the physician, you may have a response that same day of whether or not you're good or you need to do a follow-up. So I don't know, in my experience, it just goes quicker, that process. The other thing that I've noticed about preventive care here is there are a lot of tests. And it's weird because I do think in the US there are a lot of tests. However, I think because it's the idea that it's preventive, if I'm pretty consistent with going and getting my annual physical and getting, the kids their annual physical, I guess in my experience, especially, even growing up, the tests are not, especially for children, are not that extensive. I've gone to a pediatrician for an annual physical and didn't get any lab work and didn't request any. It was mostly like just, the physical exam, and then that was it. And whether I needed to get, and then that's another thing here too, but that may have to do more with the education system, whereas kids, part of registration every year for school is that your doctor has to say that you are physically capable of, all the activities and things required. And I almost think that that's a way that they sort of force parents to have that annual visit, even if they weren't planning. But like I said, it's not a disadvantage. It's a good thing. But the added piece to that is it's not going to be just a physical revision. It's going to be, okay, I'm going to need you to get these labs. So I remember actually this year with my son, just the list. I mean, there was a lot of tests. And I said to the pediatrician, like, I don't remember getting all these tests during my annual physicals as a child. And her question was, where did you grow up? And I said, the U.S. And she said, oh, yeah, because they don't really do preventive care. And it was like, okay. I mean, I didn't think of it that way. Actually, no, honestly, in the moment, I thought she was being excessive. At the same time, yes, she is checking on things before there's a symptom. And just logically, for me, that makes sense. And that's a good thing. Now, because I use the private system, that also means that that long list is all on me. Like, my insurance is not covering it per se. I do have insurance, and it's like one of those reimbursement type. I use it more, the value for me of having a policy like that here is for catastrophe, is like some huge expense, whether it's surgery, an accident, something like that. But just, again, the preventive care, because I'm going to tell you now, even with those excessive exams, and to give an idea, there were sonograms, there were x-rays, there were like blood work, there was an EKG, there was, all of those things, out of pocket, I probably spent like $250. And again, I just would walk in. A lot of those tests that I had to get done, they were convenient to get done. I would walk in, or I would call and make an appointment, and you just get them done. And then I think the EKG was the one that took the longest to get an actual written report afterwards, but everything else, like within the day, you had your results. And so then you have that piece of it where you're getting all the tests and you're getting all the test results, you're collecting them, compiling them, and then I send them all to the pediatrician, and then her, I guess, model is always then me, parent, comes back for the follow-up. Like, my kid doesn't have to come for that. And then we just go over the results. And because that's always her method, like, I never get, I never get alarmed, with any of the results, because I know that's part of the process. And if there is anything odd, we're just going to go over it in the follow-up. So it is really helpful. But again, when I think about all of those tests and the follow-up and the visits and all of that, and to know that I didn't spend, even $300, I'm not saying $300 is not expensive. I just think that it is reasonable, quite reasonable, for all of the services that we received and the convenience of the services. Because I do calculate my time and having to, go around the city looking for different things and looking for cheaper options, because I must say there are cheaper options. I just chose convenience and rapid results, but you could definitely do all those same things for less than that here. Now, when it comes to myself, I started doing this back when I was still living in the U.S., is I go to an OBGYN who sort of does my annual physical. Since I need that specialty anyway, I was so glad when they started doing it that way in the U.S., so I didn't have to go to my primary care physician and then an OBGYN. So actually, I remember probably one of my last annual physicals in the U.S. was done by a nurse practitioner, which she also was able to do all the girly tests that we need. And I've since then just have been very, again, I must say that I'm an overall healthy person. I don't usually need any follow-ups. I usually don't need any specialists aside from the OBGYN. So it works for me, and I think it just keeps costs down, being able to just go to one medical professional. So even with mine, and I am a little more involved just for my age and whatnot, but it includes mammogram and your annual pap smear and the lab works and sonograms and all of that. Out of pocket, I'm probably something like $350. Just because I have more tests and I have just more involved follow up than my son does. But still, to me, that is very reasonable. I remember when I last lived in the U.S., I had like a really good insurance policy, and I mean when you added up the co-pays, I don't know, it just added up. It definitely was not. It was not like $50 and we're done. It was like $50 every visit for seeing an OBGYN. And that was your copay. So that means that was like non-reimbursable. That's what you paid and you were done. And I just actually, before I started this episode, I looked at the cost of natural childbirth at one of the nicer private clinics here. And the package, and you should see this package. It's like, the Rolls Royce of packages, and it was about $1,600. That's private care, quote unquote non-subsidized. I'm not sure how much the government subsidizes private care. I feel like there must be some sort of subsidy because, again, it's so affordable, and yet the cost in the U.S. is about $19,000. So. Now that's comparing apples to apples because this is private, out of pocket, no insurance. Now if you have insurance, I know 15 years ago when I had my son, my copay or deductible, whatever they were calling it, ended up being almost $1,000 for natural childbirth. And I was there 2 days. I didn't even stay the full 3 days. I just didn't feel the need to. And yet it's still racked up. And they charge you, as we all know, they charge you for every little thing. Every little thing was on that bill. So it's really incredible, the difference, because you're like, you just can't wrap your head around why it's so much more expensive in the U.S. when you look at the quality of care, when you look at the ease of access, the equipment used. It's all very modern. It's not at all, and I've been in places where it's not as modern. So I think I have a good idea of that. Like, okay, no, they're not using outdated machinery and things like that. It is very comparable, just a fraction of the price. I also had a recent experience with a family member who had surgery, and again, the quality of care, the due diligence that the facility went through, the ease of access. It was so easy. We just went to the specialist. The specialist said, "Yeah, I suggest surgery," and then of course did all the pre-op, everything that you would see in the U.S. There was nothing missing from the process, and it just was, again, really good care. A private facility, so yes, pricey, but not a fraction of what it would cost in the U.S. And the follow-up, and I don't know, I really do stand behind the quality of care that is available here in Ecuador, and I know that it surprises a lot of people, especially sometimes when we choose to get care here, or even if it's elective and we make the choice to get it here versus the U.S. when we have the option. It's because I stand behind it. And of course, as a mom, I would never put my children at risk. I would never, I wouldn't skimp on that for my kids. I would, even if I would skimp for myself, but not for them. My daughter, a few months, well, it's been like 4 or 5 months now, had LASIK. And again, a fraction of the cost. This is her ophthalmologist for years, so he knows her. He knows her eyeballs. And it just, everything went well. It just was really good. It was well done. And she's happy. I'm happy. So it's really, I don't know. It's something that I'm grateful for all the time, because I've been in different situations where it's not, the quality isn't there, or it's a little bit more difficult to navigate the system. Or another thing that I really appreciate, and it's partly cultural here, is, sometimes you will sort of get all your service, you'll get everything done, and they haven't even asked for payment yet. And you're like, okay, and they're like, yeah, after. Like, there's not this rush. And I've seen this in other fields as well, like in businesses and things. There's this assumed trust. And I just think, like, when it comes to medical care, that goes such a long way, because again, you're often not feeling well, or you're worried about something, you're anxious, and to not have like the first question be like, okay, how are you going to pay for this? Will that be cash or charge? That kind of thing, that has made a world of a difference. So again, I'm extremely, extremely grateful to be living in a place where not only am I just overall happy with, being surrounded by nature and all of those other things that I love about living here, but just the quality of medical services and medical care is, to me, equal or even, higher than in the U.S. So let me know if you have any questions, any specific questions about the medical system. I'll try to answer them. The only thing that I have not experienced here is emergency services. I've, knock on wood, thank goodness, have not had to use like an emergency room, or, just go into urgent care for myself or family. But I assume it's the same. It's similar to everything else that I've experienced. And there's, and there's more of an interest for care than there is for payment. And that, to me, is really what makes the difference. All right. Well, that is my experience with the medical system here in Ecuador. Until the next time, be well.